Make sure that the patient is sitting comfortably on a stool. Explain as well as demonstrate the procedure once to the patient. A tuning fork of 512 Hz is chosen for the best results. Strike it against a firm surface like the knee or the elbow. The foot of the vibrating tuning fork should immediately be placed on the patient's mastoid process. Patient is asked to indicate by any gestures like by giving a thumbs up once he stops hearing the vibration of the tuning fork. Once the patient gives a thumbs up indicating that he no longer hears the vibrations of the tuning fork, we transfer the tuning fork vertically in front of the ears. He is asked to give a thumbs up if he is able to hear when the tuning fork is in this position. If he can still hear when the tuning fork is placed in front of his ears while he has stopped hearing with the tuning fork over mastoid, this means that his air conduction is better than bone conduction. And this finding of air conduction more than bone conduction is the normal finding. Let's try and see what is air conduction of sound waves. Any sound wave which falls onto our ear is transmitted via the external ear, which includes the pinna, the external auditory meatus and the canal, and it reaches the tympanic membrane. This sound wave causes the tympanic membrane to vibrate. The vibration continues to transmit along the bony ossicles and then to the cochlea via the oval window. The cochlea is lined by some fine hair-like projections. The movement of the hair causes release of few chemicals which causes generation of action potential. This action potential stimulates the eighth nerve to carry the auditory stimulus to the brain. In bone conduction, all these parts are crossed and the cochlea is directly stimulated by stimulation of any part of the skull bone. In Rinne's, like we use the mastoid bone to stimulate the cochlea. Remember, Rinne's is just a screening test and it needs to be interpreted along with Weber's test. So if someone says Rinne's positive, it means it is a normal finding, that is air conduction is more than bone conduction. And Rinne's negative means that this positive finding is not present, that is the air conduction was not greater than bone conduction, and therefore when we moved the vibrating tuning fork from the mastoid to in front of the ear, the patient did not continue to hear any sound. So what is this conductive deafness? It just means that the disruption of sound wave to reach cochlea by the normal method, that is through the air conduction. So the defect could be anywhere from the external ear to middle ear, which involves the tympanic membrane, the ear ossicles and the oval window. Causes of conductive deafness due to defect in external ear could involve congenital causes like maldevelopment. For example, there could be an atresia of the external ear, or there could be an obstruction like deposition of wax or any foreign body. These can obstruct the sound waves from traveling and reaching the tympanic membrane. Coming to the middle ear, in the tympanic membrane, there could be perforation which can occur as a result of trauma or due to other causes like the otitis media. Other causes in the middle ear involves acute otitis media or otitis media with effusion. Remember, otitis media with effusion is one of the most common temporary cause of deafness in children. Another locally destructive cause in the middle ear is cholesteatoma. The cholesteatoma is a benign growth of the keratinized squamous epithelium. This can cause local destruction even of the bony ossicles, and thus it can lead to conductive deafness. This is very dangerous and must be removed. Two important causes of conductive deafness due to problem in the ear bones include disruption of the ossicular chains as occurs in head trauma, and the second one being otosclerosis. Otosclerosis is the hardening of the bony ossicles, especially the stapes, and this prevents them from vibrating and transmitting the sound waves further.